Benefits. Gastric bypass has historically been the most popular bariatric procedure. Bariatric surgery data management and reporting worldwide. Since 2011, gastric sleeve surgery has grown quickly in popularity and in 2015 is the most popular bariatric surgery option, largely the result of lap bands losing market share. However, this should not take away from the merits of gastric bypass surgery. It is still widely accepted as the gold standard for bariatric surgery. Here's why.
You will lose weight. On average, you will lose 70% of your excess body weight in the first 18 months after surgery. This study shows 77.5% of excess weight loss after 18 months. Journal of Obesity, 2013. You will not be able to eat large meals, restricted pouch, stomach size. You will get sick from eating too much sugar and/or carbs, dumping syndrome. You will absorb less calories from food, bypassed intestines. You will improve and/or eliminate type 2 diabetes. Medication for high blood pressure and/or high cholesterol may be eliminated. Your hormones may adjust from significant weight loss, increasing testosterone and improving metabolism. Long-term weight loss success. Most studies show that 90% of patients maintain at least 50% of excess weight loss after surgery.
Once you lose weight and reduce medications, it becomes easier to exercise. If you are able to implement regular exercise along with a healthy diet, you may lose more than the average excess weight loss listed above. Anecdotally, you will have more energy, more confidence, and feel better after gastric bypass surgery. These benefits are hard to measure, but this study shows 95% of patients reported an improved quality of life 1 year after surgery.
Surgery day. You've made it to surgery. You've completed your psych evaluation, your nutrition consults, your physician-supervised diet, and you've survived the pre-op diet. The night before your surgery, you will need to stop eating. Try to relax, take a hot bath, and focus on the reasons why you chose to have surgery. Fear and second thoughts are completely normal. Preoperative room for gastric bypass patients. On the day of surgery, do not eat or drink anything, including water or coffee, unless your surgeon or anesthesiologist specifically gives you permission. When you arrive at the hospital, you will be admitted and will have to fill out paperwork including consents. You'll meet the pre-op nursing staff, your anesthesiologist, and often your circulating nurse, the nurse that will be with you in the OR. If you have concerns, don't be afraid to ask questions. You will then change into your hospital gown. You may also be asked to wear a pair of graduated compression stockings that are specially designed to prevent any blood clots from occurring. Most facilities will provide anti-anxiety medication. M4 will then be inserted into your arm so that antibiotics may be administered and intravenous fluids and medications have a direct path to your bloodstream. The 4 will remain until you are discharged. You will then enter the operating room, and sticky pads will be placed on your chest to monitor your heart rate. An oxygen mask will be placed on your face and then anesthesia will be administered through the 4. You'll count back from 10 and wake up in recovery.
Recovery. After surgery. You did it. The scary part is over. Now the hard work starts. Recovery time will depend on the size of the incision made. If you had laparoscopic gastric bypass surgery performed, you will likely stay in the hospital for 2 to 3 days. If your surgery became an open procedure, bigger incision, recovery and your hospital stay may last longer. The area of the incisions will be sore in the days following surgery. In the hospital, this is easily managed with medication. Your surgeon will likely have you stand and walk the same day of your surgery. This helps remove any gas left over from the insufflation, air used to expand your abdomen and provide room to operate, used during your procedure. You will likely be asked to walk around the hospital floor at least 3 times daily after surgery. Many hospitals now have patient-controlled analgesia, PCA. This is a mechanism that allows you to press a button and administer pain medication for yourself. Your surgeon will visit with you a couple of times after surgery and before you are discharged. Make sure you have and understand the discharge instructions as well as any prescriptions and/or medications that you will need once home.
Returning home. It's good to be home. But it's also a little scary. You're on your own now. Take your pain medication. You won't be sore, and the soreness, pain may get worse before it gets better. The doctor has prescribed you pain medication. Don't wait to pick it up from the pharmacy. Have a loved one get it for you or get it on your way home from the hospital. Take it as prescribed. Pain medications can cause constipation. Your discharge instructions should include guidelines for handling constipation during your first few weeks after surgery. Your doctor will expect you to walk whenever possible, but don't overdo it. You'll be very tired. Remember, you haven't eaten anything in a few days and just had major surgery. So again, don't overdo it in those first weeks, but do walk around the house frequently.
Hydrate. Don't use straws after gastric bypass. Drink your water. Dehydration becomes a real risk after surgery. Food provides us with a fair amount of our daily water. Without food, you will need to pay close attention to your water intake to prevent dehydration. Fill up a large water bottle with all the water you'll need for the day and start sipping. Do not use a straw to drink your water. It's easy to drink too much too quickly and you risk swallowing air, which puts undue pressure on your new stomach. Small sips, no straws, all day.
Sleep. You may have plans of immediately starting exercise, cleaning the house, organizing and helping out the family. You will need to sleep. You'll be tired. You'll have time to clean and organize and everything else, but for those first few weeks, plan on resting. If you have a recliner, you may feel more comfortable sleeping in it. A slight incline can alleviate some of the pain in your abdomen and reduce the risk of heartburn. If you don't have a recliner, have a few extra pillows at home.
Activity. Coughing is often encouraged to expand your lungs and brain up any fluids that may remain after surgery. But coughing hurts after surgery. Many doctors recommend using a cough pillow. Hold this tight to your stomach when you feel the need to cough. It will prevent large movements in your abdomen and reduce pain. Always follow your discharge instructions. It is typically recommended to not lift anything weighing over 15 pounds for at least 6 or 7 weeks. Keep walking. Increase your distance as your body allows it. Test out the stairs once you feel up to it, but take it slow. If a certain activity is too difficult or causes pain, don't force it.
Incisions. Do not soak in a bath. It is often recommended to wait until your first follow-up appointment before showering. It's important that your incisions have time to heal and stay clean. A little redness around the incisions is normal. Drainage, pus, and foul-smelling odors at the incision sites should be reported to your surgeon.